Hi everybody, my name is Taylor Green. I'm one of the audiologists here at Audiology Associates. As you can see, I am by myself today. Rhys is currently off celebrating the birth of his granddaughter. So, congratulations, send a massive congratulations for the family. Everyone's doing really well. So yeah, Rhys, you're going to be stuck with my face, my face by myself. I think it's just for the one video. So yeah, apologies that you're not going to be seeing the two of us sort of bouncing off each other. This is going to be just a little bit, or it's going to feel a little bit different to our normal sort of videos, so bear with me. So there's two videos in this little compilation. Now you've got one from Rhys and one from myself. The first one that you're looking at here, this is Rhys's patient. I think we've both got very similar wax removals in this video. It looks a relatively easy type of wax to remove, but this is pretty solid. This is pretty tough in there. Now Rhys has just popped a little bit of oil in just to try and help with the removal. The reason we use the oil a lot of the time in clinic like this, it doesn't seem like it doesn't seem like it does a great deal, but it actually does really help us. If it's the first time that you're watching these videos, the reason we put loads of this oil in is to almost kind of act like a lubricant, is the only way I can kind of describe it. So where you've got these little gaps around this sort of solid plug, you can see it's slightly mobile. It's kind of moving a little tiny bit, which is good. That's what we want. Every single one of those little movements that Rhys does, that oil is just going to slip underneath that wax, and it's actually going to help us to slip it out eventually a little bit easier. So that's the reason why we usually suggest a couple of days of oil as well before coming in, because it does help to soften up the wax as well. But you can only use oil if you're able to. So if you've had any, if you've got perforations, or if you've got a history of, really complex issues with the ears, just keep it dry. I wouldn't bother. So we've got the standard size Zollner tube, which is the larger of our suction tubes here. This is the first time I'm seeing this myself, so I'm literally just voicing this over as if I'm watching it with you guys. So what I can see Rhys is trying to do here is detach that bottom section. It's not doing a great deal at the moment, but I can see there's quite a bit of this sort of it's like a thin layer basically that's kind of still attached to the top, and I think that's what's holding most of this in place. You can see there's a lot of loose hair that's kind of mixed in and trapped within that wax as well, which is nothing to worry about. That's purely a lot of the time it's from where the patient either trims their own ear hair or from haircuts, because you can get some little bits that will, over time after every haircut kind of drops inside the ear canal. As the wax starts producing, it just kind of traps it. It's starting to move, That's good, little bit of wiggling going on there. So I could imagine this patient would have been having quite a few issues with the hearing on this one, just purely because it looked quite compact and very deep. So can sometimes be a sign that cotton buds have been in use, or some sort of foreign object has been used to try and clean this out. The difficulty we get with these, it doesn't look like it on the videos, but the difficulty with these really dry ones is you can't get a solid grip with the suction, but at the same time, with the position that we're working in, with us being this deep inside the ear, it's going to be very difficult to use manual tools there, but Rhys has luckily managed to pull this free. So I could imagine if this gets trapped, Rhys is going to switch over to a bit of curettage. He's going to use a manual tool. I might be wrong. Yeah, you can see it's just kind of trapped in the, that first bend in the ear canal there. Just needs to try and bring that around, which is very difficult if it's quite a long plug, especially with it being quite hard. Yeah, there it is. Look, he's got forceps going in there now. Little ledge to grip hold of. It's just gonna going to push it in further. All the work you've done trying to get that out, very difficult. You're just going to push that further in. Is he going to manage to get a good grip here now? Oh, I did not see that sticking out there. Very gentle. I was saying on one of the members' videos last night, guys, sorry, that this feels really strange. It's like me starting all over again doing these voiceovers. Not used to doing it by myself. I'm used to bouncing off Rhys, you know. We're used to, you know, chatting about random stuff. But yeah, this feels really alien. He will be back. He will be back. Yeah, he's got the Rosen inserter in now, which is one of my favourite tools. Actually, I quite like using the Rosen inserter, especially for this type of wax, where it's really dry. You know, there's tiny little gaps around the sides of the wax. He's done a good job there. Yeah, it's looking good. Yeah, there's absolutely fine, nice and clear. Eardrums looking nice and healthy as well. Quite humid in there. Now, you can see there's not really much going on in this ear canal. Eardrum's nice and healthy. Standard size on the tube. So with this, with these patients where you've got these kind of, you know, little bits near the entrance like this, it's not so much that they've been having issues with the hearing. I know you've probably heard us saying this, you know, quite a few times, but this is going to be more of an issue with like a sensation. Something is in there. Something's, you know, causing the ear to get quite itchy, to get quite dry. And that's basically what we've got here. We've got this thick kind of layer of dead skin that's going what looks like most of the ear canal, but at least halfway. But I think if Rhys tries to lift that, that's just going to start peeling further down the ear canal. Coming away okay so far. Brilliant, just cleaning up, tidying up some of those last little bits there. Yeah, that one is done. So the same patient, so you can see this is the one now that the patient's obviously come in having their issues with. So we've got standard size on the tube, I want to say is going to come in now. Yep, there we go. Oh, that's a little bit wetter than what I thought it was going to be. I thought that was going to be quite dry. Oh, it's a mushy type of wax. What I think Rhys is going to be hoping for here is that there's going to be a deeper section that's going to be a little bit harder. So if this patient's been using oil, a lot of the time if it's completely full, the front section of the wax is going to be mostly affected with the oil, and then you've got this little section at the back that just hasn't quite had any oil to it. So you're gonna find that it'll be quite dry, which, you know, is not a bad thing. It comes out easier generally when it's when it's all in one big piece. Oh, this is thick. It's the type of wax that kind of blocks up your suction tube every 2 minutes. There we are. He's doing a good job there. What he's basically doing here, rather than just going in and trying to pull it out, what I can see what Rhys is doing is he's trying to detach that plug from the ear canals, and in turn what that's going to do is allow the wax to obviously become free, and that, as you are seeing here now, it's going to start moving a lot more freely. So we're going to get a good grip here now, little wiggles. Oh, they're dark as well. That can be a sign that the wax has been in there for a little while. So if the wax, you can see, on occasion is quite dark, is almost black in colour, that can be a sign that it's quite old wax. Just doing a little bit of tidying up now, a couple of little tiny bits that are left in there. Nothing that we would be concerned about, but you can see this big plate just on the side here. Rhys is going to see how free this is, which is not very. having to peel this away now. Oh, they're painstaking, these little bits. They're so thin. But what we have to try and do in this area inside the ear canal is to avoid the ear canal as much as we can. So I can see Rhys has kind of left that little bit there because it's a very, very sensitive area. But we got just 3/4 of an inch there. Yeah, very, very tricky ones there. Thank you for watching the video, guys. Rhys will be back soon, as I said. I think he's going to be back. We got one more members video that is just going to be myself, and then I believe Rhys is going to be back afterwards. So as always, take care of yourselves, take care of your ears, and take care of one another, and I shall see you again on the next video. Thanks, guys.